أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. So this is our third lesson, and in our lesson today we shall be talking about nursing care and ward management. So these are our lesson content. So of course we have the introduction, then we shall talk briefly about the history of nursing, the functions of a nurse, the meaning of a nurse. Then we shall also talk about the role of a nurse in the healthcare team. Then we shall also talk about ward management and what it means. Then lastly, we shall talk about the components of ward management. So this will basically be our content for our today's lesson. So this will be our lesson objectives. That is, after going through this lesson, you will be able to, number one, identify key milestones in the history of nursing and explain their significance in shaping modern nursing practices. Number two, describe the primary functions of a nurse. Number three, you will be able to define nursing care and differentiate it from other forms of healthcare. Number four, analyze the critical role of nurses within the health system. Number five, define ward management and discuss its importance. Then lastly, you will also be able to identify and explain the key components of ward management. So this will be our objectives in our today's lesson. So in the introduction, they're telling us that nursing has been around for a very long time. So the issue about nursing, taking care of each other, this is something that has been there for a long period of time. People have cared for others since ancient times. But the study of nursing is still new, but it is developing quickly. Nursing, as you all know, is about caring for everyone. That is, people of all ages, families, and communities. It aims, so these are the aims and the objective of nursing. It aims to promote health, prevent sickness, and support those who are ill, disabled, or nearing the end of life. So, to become a nurse, someone must complete a nursing education program that is recognized by the proper authority. In many countries, if you want to practice nursing, then in some countries you have to have a degree in nursing. And in some countries, like in Kenya, there is a medical school that you have to pass through. That is number one. Then number two, you also have to be registered. There is a council that is registering nurses to practice. So in many countries, you cannot start practicing unless what? Unless there is what? You cannot start practicing unless you've been registered. So to become a nurse, someone must complete a nursing education program that is recognized by the proper authority. In this case, the proper authority can be the government, university, and the regulatory bodies. And nurses are trained and allowed to, so somebody can ask, like, why do we basically train these nurses? Why do we have to? Why do we have to train these nurses? So number one, we train them to provide general nursing care, promote health, prevent diseases, and care for those with physical or mental challenges in healthcare setting and in the community. Number two, we also train the nurses so that they can be able to teach people about healthcare. Remember, one of their key responsibility of the nurses is to spread awareness, education, and advocacy. Then number three, work as a part of a healthcare team. If you go to a hospital, there is the healthcare team. So nurses are part of that team, which has the doctors, the gynecologists, the orthopedics, the opticians, ila ghairi dhalik. Then we also train them so that they can train and supervise other nurses and helpers. So the nurses, that is why when you go to many hospitals, you will find that we have senior nurses. So the senior nurses are responsible to train the junior nurses. Then lastly, participate in research. So the nurses are also supposed to engage in research activities. They have to research ila ghairi dhalik. So these are some of the reasons why we train the nurses. Now, this word nursing in itself, what does this word mean? Somebody can ask, like, when you're talking about nursing, what does this word basically mean? So the World Health Organization defines nursing as, so nursing constitutes three things. Nursing has three things. So when you're defining, if you're asked to define nursing, then you have to mention these three elements. The first one is care. That is providing autonomous and collaborative care for individuals, families, groups, and communities, regardless of age or health status. So that is the first responsibility of nursing. So the scope of nursing is providing care, free care. As in, when you're talking about autonomy, we are talking about the element of freedom, autonomy, and collaborative care with other individuals. Number two, health promotion, promoting health and preventing illness. Then lastly, care of the ill, caring for people who are ill, disabled, or dying. So this is what nursing basically constitutes, these three things. Now, what is the history of nursing? How did nursing start? So during your free time, I'd like you to go to the internet and do a research to see like how nursing developed, because it did not just start in one day, no, but throughout the years. So nursing has a history of how it developed. And the person who is associated with the modern nursing is known as Florence Nightingale. I think she's from Italy. She was born in Italy, but she died in UK, London. So Florence Nightingale is a key figure in the development of modern nursing. Why? Because she advocated for training women as nurses. She was the first person among the few people who actually called for and advocated for training of women as nurses, leading to the establishment of the first nursing school in the 1870s. Initially, nursing education was limited to hospitals, but by the 1920s, it expanded to do what? It expanded to universities. So this is just but a brief history of what nursing is all about. Now, on to the next thing. What are the functions of a nurse in any given hospital? So number one is the normal thing, caregiver. Nurses serve as caregivers, providing both physiological and psychological support to patients while maintaining their dignity. So when you're talking about the physiological support, we are basically talking about when patients are in the hospital, sometimes they need food. Sometimes they need a place to sleep. So these are associated to the physiological. And psychological is related, it's a mental thing. Sometimes when you go to the hospital, there are patients who are stressed. So it is the role of the nurse to play like a guiding and counseling person. So that is the physiological, that is the psychological support. But to patient while maintaining their dignity. Dignity means that the nurse has to respect the patient. Number two, communicator. Effective communication is essential in nursing. Nurses interact with patients, their families, healthcare professionals, and the community. They listen to patients' concern and relay this information to the rest of the healthcare team, making strong communication skills vital to nursing care. So if you want to be a nurse, or if you're claiming to be a nurse, then you should be very good in communicating. Why? Because you are interacting with many people. You are interacting with the patients, their families, you are interacting with the doctors, the physicians, and you have to listen to the patients, what is their problem, and these problems you need to relay it to the doctors. So you cannot be a nurse if you are not good actually in communication. Also, number 3, the nurses are like a teacher. Nurses educate patients about various procedures related to their treatment and assess each patient's ability to learn in order to tailor their teaching approach. So a nurse is just like a teacher. Just like you have a teacher in a class, so the students in the class, they are the patients, they are masakin, they don't know. So the teacher has to guide them. So even when the patients come to the hospital, or most of them, sometimes they don't have basic education, So the nurse has to educate them. The nurse has to evaluate them, to know their abilities. Client advocate. Nurses act as advocates for patients, voicing their needs and preferences to other healthcare providers. So the nurses, they are like the lawyers. They are like the lawyers for the patient. If you go to a court, you normally have a lawyer because in a court, we normally have a plaintiff and a defendant. So the defendant always have a lawyer. So in the hospital, the nurses are the advocates of the patients. So they voice the needs of the patient to the other doctors. Hey, this is my patient. I know him. He does not eat well. He does not sleep well. So he's the one who is voicing your concern to the other medics in the hospital. Also, the nurse can also be a counselor. So nurses provide counseling and emotional, intellectual, and psychological support, helping patients navigate stressful situations. This is what I was telling you before. When patients are being treated in the hospital, what normally happens is that sometimes they are depressed, sometimes they are stressed, sometimes even the environment is not good there in the hospital. So they really have to be supported. Then the nurses, there is the role of the leader. So nurses assume leadership role, guiding and motivating others to work collaboratively towards common goals. A good nurse is the one who will always push, who will always lead the other nurses so that they can work together, whether for individual patients, families, groups, colleagues, or the broader community. So that is basically the work of a good nurse. Now, nursing care. So we've been talking about nursing, but what is nursing care? So now there is the word care. So according to the World Health Organization, nursing care is the autonomous and collaborative care of individual families, groups, and communities. It includes 3 things. Number 1, we are promoting the health. Number 2, we are preventing illness and caring for people who are ill, disabled, or dying. So in summary, when they're talking about nursing care, they're basically telling us nursing is preventive and curative at the same time. So when you're talking about preventive, it is promoting the health. So even before somebody gets sick, they normally say, al-waqaya khairun min al-ilaj. That is, they are promoting health. So nurses have to promote health. So they'll always advise people to eat balanced diet food. They'll always advise people to use mosquito nets. They'll always advise people, for example, to regularly check their status, their health status. So that is preventive in itself. That is promotive and preventing illness. But Number 3, caring for people who are ill. That is now curative. So number 1 and 2 is preventive, but caring is curative. So what is the role of a nurse in the healthcare team? So remember, the nurse is not working alone. The nurse is working together with the team. So what is the work of a nurse when the nurse is working together with the health team? So number 1 is nursing care. That is the first role. Remember, we were talking about the role of the nurse. So the first role of the nurse in the healthcare team is nursing care. What is nursing care? It's all about medicines. So nurses can recommend and administer medication to patients. So with the guidance of the doctors, they can do it. They can do what? They can recommend and administer medication. Minor surgeries. Nurses are capable of conducting minor surgical procedures when necessary, not all the times. But when necessary, they can do it. Home care. Nurses provide care similar to hospital setting in patients' home. This normally happens especially in Europe. If you go to Europe, you will find that nurses, they normally go to what? Nurses, they normally go to houses. They normally go to houses of what? Of the patient. They don't treat them in the hospital. Community support. In under-resourced communities, nurses identify common health issues and offer care. So you have some countries, especially in third world countries. So you find that the nurses, they'll go to the community, support them, Then lastly, collaboration. Nurses work alongside others. So this is the first role. Number 2, the role of the nurse is patient care. So 24/7 care, ensuring patient comfort and well-being. Nurses, they always have. In fact, that is why if you go to any hospital, you'll find that the nurses are working. They are the only health practitioners that normally work for many hours. They always have to be there when the patients need them. They have to monitor the breathing of the patients, the nutrition, the hydration, if the patients need water, and rest. They need to assist with personal care. If the patients have difficulty in going to the toilet, for example, excretion, mobility, if the patients cannot move, the nurses are the ones who are supposed to be there to help. They prevent bed sores and stiffness through regular repositioning. If you go to any hospital, you will find that the nurses, there are some patients, they cannot move themselves when they are sleeping. So after 1 hour, they will come, change the position of the patient. After another 1 hour, especially the patients who have undergone some surgery. Then make independent care decisions within guidelines. So they also have the autonomy to make some decisions, independent care decisions, but within the guidelines of the hospital. Then number 3 is assistant to physician. So they need to collaborate with doctors for patient diagnosis and treatment. Patients, they always, if you look at the picture, the nurses, they always help the doctors. They perform treatment according to setting the 4 lines and administering fluids, giving injections, changing dressings, monitoring wound healing independently after consulting with doctors. So these are the assistants' role. Then coordination role of the nurses. They collaborate with healthcare teams members. They supervise nursing and housekeeping staff. They engage with family members in patient care. So if patients come to the hospital, the nurse will always guide them, inform them about the condition of the patient, if the patient is responding to medication, if the patient needs extra care, extra support. That is the coordination role of the nurses. Then patient protection. The role of the nurse is to ensure a safe environment to reduce infection risk. So as a nurse, you should always ensure that the environment that the patient is in is a safe environment. Because if it is not safe, then what will happen to the patient? He will be infected by maybe even other diseases. Maintain cleanliness and sterility of tools, materials. It's the role of the nurse to always ensure that the patient's ward or the patient's room is extremely clean. If it is not clean, they have to coordinate with the cleaners. And sterility of tools, the tools that they are the tools that they are using, the injections, it has to be also sterilized. Uphold patient dignity and privacy. Remember when you were talking about the healthcare law, we talked about the importance of dignity and privacy. The nurses, they cannot share the patient's information with anybody without the consent of the patient. If they do that, then they will be attracting some court cases. Then education and advocacy. So the nurse, they have to educate the patients and families on health management and hygiene. So sometimes the patients, when before discharge and after discharge, there are some things that the families and the patients, they need to know. So it's the responsibility of the nurse to do what? To educate them. Teach skills for recovery, e.g. breathing techniques, crutch walking. So there are some skills the patients need. So what the nurses should do, they should be training the patients how to use the crutches, how to breathe, basic skills. Act as patient advocates during critical times. So during critical times, sometimes you find that during emergency, the patients, they cannot speak. So who is going to speak on their behalf? The nurses, because the nurses have been close with them and they've been monitoring their situations. Be present for emotional and physical support. Then lastly, communicate patients' needs to the healthcare team. Communication. Establish effective communication with patients and family. As a nurse, remember, before we said that a good nurses, they should have good communication skills. This will enable you to connect to both the patients and their families. But if you're poor in communication, then how are you going to do that? Number two, listening. Empathetically address patient needs. Nurses, they have to be good listeners. It is only through listening that the nurse can be able to know the needs and the wants of the patients. But if you are the kind of nurse who is not a good listener, then you're going to miss a lot of things. Confidentiality, share relevant patient information judiciously. Anything related to the patient, you have to share it judiciously. Judiciously means rationally. Don't share the information about the patient with everybody, anybody, for example, no. Only close members, for example, they have to know the conditions of the patients or information related to the patient. Empathy, arifq and rahma. Understand and respond to patient emotions. So if you want to be a good nurse, you should have a rahma. You should be understanding. Sometimes the patients might seem to be disturbing you. So you need to have empathy, and at the same time, you need to be patient. If you cannot be patient, then it's better you go and look for another job because you cannot work in the hospital. Then patient evaluation and record keeping. It's also one of the roles of the nurses. So monitor and record patients' progress and needs. For example, so this background information, review patient charts, observation, look for changes in conditions. So every time you have to monitor, see the breathing, is it normal or is it not normal? Patient interaction, discuss pain and medication with respect to confidentiality, physical examination, conduct thorough assessment of the patient, equipment checks, ensure proper functionality of medical devices. So you have to ensure that all the devices, the equipment in the patient's room is working. Environment assessment, maintain a clean and safe space. Vital signs monitoring, track the temperature, pulse, respiration, blood pressure. Care planning, develop nursing intervention based on patients' needs. Documentation, accurately record care procedures and outcomes. Then evaluation, as a nurse, you need to assess effectiveness of provided care post-intervention. That is, e.g., after pain management. So these are the roles that are associated with patient evaluation and record keeping. Okay, the second part or the last part of our lesson is about ward management. So when we are talking about ward, I think you are all familiar with what a ward is. So a hospital ward refers to a designated area, place, or location, or a set of rooms within a hospital where patients requiring similar types of care are accommodated. So if you go to some hospitals, you will find that the ward it's just a very big hall. All the patients are in there. Like, for example, in the picture, this is a ward. So you have the curtain. The curtain is the one that is separating this patient from this patient. You know, in some hospital, for example, if you go to some hospital, you will find that every patient has a room. They have their separate ward. They don't share. So sometimes you can find it is a specific area, or it is just one area, but it is separated maybe by curtains. Now, what is the objectives of ward management? Why do we, in a hospital, why is it important to manage the ward, the rooms? Number one, to deliver high quality nursing care to all patients. Number two, to guarantee that patients are in a clean, sanitized, and well-ventilated environment, protecting them from infections, accidents, and other potential dangers. So the ward should be extremely clean and sanitized and well-ventilated. Then number three, to support staff in achieving job satisfaction. And lastly, to offer suitable facilities for patients and their caregivers. So good hospitals, they will always have good wards, especially the private hospitals. If you go to private hospitals, you will find that they have good halls, good wards. But sometimes if you go to public hospital, they have the wards, but the wards, in one room, there are 5 patients, they are crowded, not well ventilated. So many people sometimes will not prefer taking their patients for admission in public hospital. Now, components of ward management. When you're talking about ward management, then there are 4 things that are involved in ward management. Number 1, patient care. Number 2, personnel management. Number 3, supply and environment and equipment. Then lastly, environment cleanliness. So let us start with the first one, patient care. So what is the meaning of patient care? So patient care encompasses all activities necessary for delivering nursing care. The primary principal focus on ensuring patient comfort and maintaining their health. Key aspects of patient care include, so number 1, admission and orientation. If you go to any hospital, you have to welcome patients and help them understand the ward procedures. So you have to welcome them. Oh, this is your ward. This is the toilet. You know, this is called admission. Assessment of needs. You need to evaluate the individual needs and condition of each patient to tailor care. So when the patients come, you need to assess what are their needs. So if you know their needs, you can know how to fix them. Then there is the progressive patient care, continuously providing care as the patient condition evolves. So of course, the patient will come day 1, day 2, day 3, day 4, day 5, and their condition will not be the same. It will be improving. Time and work schedule, you know, planning and organizing care schedule for staff. We have ward rounds, regularly reviewing patients' conditions. So if you are a nurse, there is what is known as ward rounds. Like every 30 minutes, you have to go around and check. Maybe the patients, they are in need of something. But in some hospitals, you find that the nurses, they don't go around most of the time. Records and report. You should be doing what? Maintaining accurate documentation of patient progress and care. Every time you go out to see the patient, you record. Their breathing, their pulse. Emergency management, effectively responding to emergency as they arise. Client patient education, and the price. So this is the first part. Number two, personnel management. Of course, in the ward, we have people who are working there. So what should we do? Number one, orientation of new staff, introducing new personnel to the ward environment and their new roles. For example, you have a new nurse. The new nurse is miskina. They don't know the ward. They are new to the hospital. So we have to help them understand the ward. Supervision and delegation, overseeing staff members and assigning specific responsibility to them. We need to assign, hey, nurse A work here, nurse B work in this area. Interpersonal relationship building, there should be good relationship between the nurses. Staff evaluation, we need to evaluate. The manager of the hospital needs to evaluate the nurses to ensure that they are working. Staff conferences, we need to hold meetings with them, give them the updates. Staff development programs, we need to train our nurses. Then lastly, health, safety, and welfare, ensuring a safety and healthy work environment for all personnel. Then the environment has to be very clean, environmental cleanliness. So number one, the temperature should be regulated. It should not be too hot, and it should not be too cold inside the room. So it should, once we evaluate the regulated temperature, it will ensure patient comfort and safety. Number two, the lighting in the ward. It should be sufficient natural or artificial light. It's preferable the ward should have big windows so that it can allow the natural light. Removal of unpleasant odors. Odors mean smell. Sometimes the smell should not be unpleasant. Ensuring that the ward is free of foul odors through proper sanitization practices and ventilation. But in some hospitals, when you go to the ward, you feel like vomiting because the ward is dirty, not ventilated. Controlling dust, implementing measures to minimize dust accumulation, thereby promoting a cleaner and healthier environment for patients. Then safe disposal of excreta, the urine, the feces. You have to ensure following strict protocols for the safe and hygienic disposal of such waste. Then lastly, supply and equipment management. Because remember, the ward, they need some equipment. So number one, we need to check the condition of equipment. We need to regularly inspect all medical and care equipment to ensure they are properly functioning. Number two, managing shortages. Sometimes you go to the ward, you don't have enough water, you don't have enough syringes, you don't have enough, so you have to manage. In case you don't have, you bring more. Checking supplies for effectiveness. Regularly reviewing supplies, e.g., medications, medical devices, to ensure they are effective and appropriate for patients. Then ensuring safety of expiry dates. Vigilantly checking the expiration dates of all supplies, particularly medication and sterile items, to prevent the use of expired products that could jeopardize patient safety. Then safe handling of supplies. So we need to implement protocols for the safe storage, handling, and disposal of medical supplies to prevent contamination or injury. So these are the four elements, the four elements of any ward, be it an open ward, because you said that some wards, they are open, just like this, an open ward. Sometimes you will find some wards, they are closed. So whatever the case, we need to always ensure that these four items are there. Okay, so is there any question as I take the attendance? If you have any question, you can ask as I take the attendance. Is there a question? Okay, if there is no question, I think we will meet tomorrow. If there is no question, I think we will meet tomorrow. Tomorrow we'll meet at the normal time. Tomorrow is, or tomorrow we can meet at the same time. No problem. Because tomorrow is Friday, we can still meet at 4:30. I think that will also be ideal. So tomorrow, the same time at 4:30, we'll meet for our fourth lesson of the course. Okay? Okay, thank you.